why is it that boys are more likely to be diagnosed with autism than girls? Why is it that older people with hearing loss are more likely to develop dementia? And why do trans people show such high rates of mental illness and suicide? For our final video on the biopsychosocial model, we'll take a look at how social factors affect mental illness. Although the situations I mentioned earlier appear very different, they each have sociality as a major contributing factor. For example, hearing loss can cause older people to withdraw from society. If someone finds it difficult to hear and follow a conversation, they might choose to stay home instead of going out to social events and risk getting embarrassed by asking, "Sorry, could you say that again?" over and over and over again. Unfortunately, this in turn means that the brain is no longer receiving the same degree of stimulation, and the person no longer receives the health benefits of sociality, community, and friendship, and this in turn can put the person at an increased risk of developing dementia. Gender can also affect a person's risk for developing different disorders, as well as the diagnosis they receive and even the effectiveness of the treatment. Depression is one of the disorders where gender plays a starring role. The overwhelming majority of people diagnosed with depression worldwide are women. Some people have argued that this is simply an artifact of men being undiagnosed due to social stigma. And yes, it is true, there are significant social obstacles that prevent men from seeking a diagnosis, particularly with their mental health. But what happens when we look at undiagnosed depression? A meta-analysis of over 3.5 million people from 90 different countries around the world found that women are still 1.95 times more likely than men to develop depression. And that's taking into consideration both diagnosed and undiagnosed symptoms. Now, this doesn't mean that men don't get depressed, because, as the authors point out, in a society where 10% of women have depression, 5.4% of men also have depression, and that is not an insignificant figure. Yes, it's important to acknowledge the gender differences in prevalence, but it's also vital to acknowledge the social risks that that knowledge carries. One of the risks of this knowledge is seeing depression as a woman's issue. This perception not only minimises the debilitating effect that depression has on women, it also simultaneously ignores the millions of men currently being crippled by depression. Negative stereotypes like this, as well as traditional gender roles and ideologies, are major obstacles to men seeking treatment for their mental health. This is particularly true for older men. Their low uptake of mental health treatment is one of the factors that contributes to this population's high risk of suicide. Gender roles can also affect how successful different psychological therapies are. A recent study into PTSD treatment suggested that women's familiarity with processing emotional information helped them to get more benefit from therapy, whereas men's tendency to suppress and avoid their emotions became an obstacle to recovery. We could not have a discussion about the social effects of gender on mental health without acknowledging the challenges faced by people who are transgender and gender non-conforming. For students not familiar with these terms, transgender refers to a person whose deep internal sense of being male or female does not match the sex that they were assigned at birth. Gender non-conforming refers to a person whose gender identity doesn't neatly fit with what society traditionally recognises as masculine or feminine. And this umbrella term may also encompass people who do not identify with either of the binary constructs of male or female. Instead, their gender may be a fluid combination of these identities. Others may not identify with either of these genders at all and may instead identify as non-binary or genderqueer. Still, others may reject the social construct of gender altogether and identify as agender. This is by no means an exhaustive list of gender identities, and we could never hope to unpack all of the nuances and complexities of gender in this space. It is simply a brief introduction so that we're all familiar with these terms. Similar to other social minority groups, People who are trans and gender diverse face significant social obstacles that can in turn negatively affect their mental health. Some have suggested that the reason that trans and gender diverse people experience mental illness at a higher rate than cisgendered people is because they're experiencing gender dysphoria. Gender dysphoria is the psychological distress that a person can feel when their gender identity doesn't match the sex that they were assigned at birth. But gender dysphoria is not the primary concern of this population. Instead, social issues like discrimination, prejudice, harassment, the increased risk of being a victim of violence, and a lack of understanding by medical professionals are the primary driving forces behind the mental health issues experienced by trans and gender diverse individuals. It's social factors that contribute most to this population's heightened risk of depression, anxiety, substance use, post-traumatic stress disorder, and suicide. Mental health issues are not intrinsic to what it means to be trans. Because of this, some people have questioned whether it's necessary or even ethical to include gender dysphoria as a disorder in both DSM-5 and in the World Health Organization's International Classification of Diseases, or ICD. Many researchers and advocates argue that gender dysphoria shouldn't be recognised as a disorder, just as homosexuality is no longer recognised as a disorder. But on the flip side, many trans people's health insurance only covers access to hormone and surgical therapies because of this classification. We can probably accept that the average person is always going to be influenced by their social environment. But we generally hope that researchers, doctors, and mental health professionals can put aside things like gender stereotypes so that they can do their job. Unfortunately, the research shows that expectations about gender roles can contribute to diagnostic errors. For example, DSM has been repeatedly criticised for the personality disorders in particular being heavily based on traditional gender roles. This in turn can pathologise people who don't fit the social norms. Over 30 years ago, researcher Paula Kaplan argued that, quote, many of the behaviours thought to be associated with masochism actually appear as part of the normal woman's personality because sex role stereotyped patterns teach women to learn to accommodate the realities of society as they develop. Rather than self-defeating behaviours, they actually enhance a woman's desirability for marriage and motherhood. It's these same learned gender roles that contribute to autism being frequently missed in girls. Society spends a lot of time teaching girls how to conform and behave in society. Some girls with autism rote learn these rules and follow them like a script. It's only later, when she enters adulthood, that this rule book no longer covers all possible social scenarios, and so the deficiencies in her social functioning is finally exposed. I should point out that it's not entirely clear how much of this underdiagnosis is due to girls with ASD rote learning social rules, and how much is due to a genuine difference of how ASD presents in boys and girls. We can't remove the effects of a society, so this is a challenge that researchers will have to find a creative solution to. Of course, a small course like this can never unpack all of the complexities of how society, culture, and interpersonal experiences can affect our mental health. I hope that this short introduction has helped you think more deeply about the relationship between sociality and psychopathology, as well as how social factors like gender can interact with biological and psychological processes, which is the biopsychosocial model. Next week, we're going to take a break from our regular lecture content. Instead, we're going to get started on our written assessment. I'll see you next time for Essay Week.